So I'll just begin with the class. Just one thing that you might be knowing, that your exams are knocking on your door. They will be held in the month of August, and your practicals will be held in the last week of August. Okay, in all likelihood from August 31st to September 3rd. Okay, practicals, professional exam practicals. Professional exam theories will be in the first week of August. Professional exam practicals will begin from 20th of August. So they'll start from 20th of August, but we'll be having it tentatively in the week that is 31st, 1, 2, 3. 31st August, 1st September, 2nd September, 3rd September. That is the tentative days. As of now, it's not final, but just to keep you informed. So you'll get some time after your theory exams. Silence please, no talking. So you'll get some time to prepare yourselves between the theory exams and the practical exams, right? Okay. So what we are going to discuss today is both a topic that is important for your theory, but more important for your practical. Okay. So what we are going to discuss today is basically, so this part comes under environment. Okay. Under your environment chapter, you need to know some things about. So this comes under environment. Okay. Under environment, you need to know about air, water, noise, and various other things. So under water, this topic comes. Okay. We know that water, why is water important for us in public health, in community medicine? What is the importance of water? Borne diseases. Okay. So we know that there are various diseases that are attributed to water. Some are waterborne, some are water washed, some are water related, isn't it? So it is very important that we have some measures of treatment and control of water, so that water is safely usable both for domestic purposes as well as for drinking purposes. Right. So to begin with, we want to know that what is safe and wholesome water. Okay. So for any water that should be used, that can be used in the domestic purposes for the purpose of drinking or for the purpose of domestic usage, needs to be safe and wholesome. So for water to be classified as safe and wholesome, first and foremost what is necessary is that it has to be free from all kinds of pathogenic organisms. That is, it cannot contain bacteria, virus, and it cannot contain bacteria, virus, protozoa, any parasites, most importantly spores as well, right? Spores as well. So it should not contain any microbiological elements either in their active dividing form or in their nascent form, right? So it has to be free from pathogenic agents. Next, it has to be free from harmful substances. Harmful substances as in, there can be harmful chemical substances, for example, arsenic, nitrates in too high amount, sulfates in too high amount, isn't it? Ammonia in high amounts. The good thing about ammonia is, if ammonia is present in high amount, it gives a characteristic smell. So from the smell only we can reject it. But there are some other things like arsenic, which even if it is present, it does not obviously let us know that it is there. So that creates even more problems, right? So for water to be safe and wholesome, it must be free from pathogenic agents. It must be free from harmful chemical substances. It must be pleasant to taste and smell. That is, it should be free from any kind of odor or color. And it should be then, if it satisfies all of these three, it automatically becomes usable for domestic purposes. So these are the criteria for safe and wholesome water. Now what are the sources of water commonly in our country? Domestic usage, one is rivers, river water, pond water. Other than that, tube wells, right? So not so much in India, not so much in northern India now, because we have got systems of, having treatment plants who take up the water from the river, purify it, because northern India has access to all of these snow-fed perennial rivers. So we take up the water from the rivers, purify it in large treatment plants, and then send it by piped water supply. And we also have some tube well system in various domestic households. But if you go more towards the central and southern India, which are having a stable plateau based landscape having a subsoil of rocks, there we have a lot of wells, isn't it? There wells and tanks are a key source of water throughout the year. So whenever we have wells and tanks, you know, sanitary well, so this PPT also contains the what are the features of a sanitary well, or what are the features of a good quality water storage. Okay, how it should be, how its walls should be, how its entry should be, how the mechanism of withdrawing water, putting in water should be, what kind of drain, and all of that. I will not go into the details of that. You can read it. It's there in your book. It's there in the PPT also. When I give you the PDF, you'll have it. Okay. But what you should know that, so the wells and the tanks, they should have a definite construction and usage for them to be considered sanitary. Okay. Just to introduce, sanitary well is a one that is properly located, well constructed, well protected from possible locations of contamination to ensure supply of safe and wholesome water. Right? Now, location, why is location important? Because there is something known as a cone of filtration. Okay, there is something known as a cone of filtration. So, if I have a well, depending on its depth, it has a cone of filtration. Cone of filtration as in where in the surface if you give some water, that will eventually filter and reach the well down in the bottom. Okay. So, you should not have any possible sources of contamination within the cone of filtration of a dug well. Okay. So, based on this, various things have to be taken care of. It has to be located at a high place which does not have water inundation. Water collection should not be there. Flowing water should not flow through that area so that it might go into the well. Even after that, we will have to elevate the margins by parapet wall. We must have a constructed cement surface around the well. There should be a drain so that the collected water, while collecting water, some water spills, but that water also touches us, so it becomes contaminated. That should not go back directly into the well. So for that, there should be a well constructed drain. Like this, there are various features of sanitary well. It's very, very important for your theory exams also. Read it well. Characteristics of a sanitary well. Very, very important, right? So now what can happen if a well is not sanitary, or even with a sanitary well, at some times it can become contaminated, right? It can become contaminated, and whenever it becomes contaminated, then it can have various pathogens growing in it. Now what are the common pathogens? As we can see from here, that water, the risks from water to us can be through gastrointestinal pathway, can be through respiratory pathway, or can be also in skin. Especially if it is coming in contact with our eyes, or if we are having any cuts where it is coming in contact with the mucous membrane, right? So, but most commonly the illnesses that we have are gastrointestinal, and gastrointestinal illnesses, they can be by bacteria, they can be by viruses, they can be by protozoa and helminths. Okay. So whenever there is a contamination, be it a contamination with a chemical substance, be it a contamination with a pathogen, water needs to be disinfected, isn't it? One of the techniques of disinfection is chlorination, what we are going to read today. But always and always remember that chlorination cannot be a single sufficient disinfection method for water. Okay, because chlorination can only work effectively against bacteria and other living microbes, maybe protozoals, but not all protozoa. For example, Giardia, chlorination is not effective. Okay, viruses, chlorination at normal levels is not effective. Spores, chlorination is not effective, right? So chlorination as a single adjunct is not good for disinfection. Why again? Because suppose your water is turbid. Turbid means, what is turbidity? Turbidity is the lack of clarity in the water. When you take up water and you see through it, you should be able to see what's on the other side, like in your bottles, if it's a transparent one, right? But if water becomes turbid, then it becomes translucent, right? So whenever there is turbidity, turbidity happens due to some suspended particulate matter. Okay, that suspended particulate matter usually at the size of greater than 10 to the power minus 6 meters, right? So like something that is not becoming dissolved, it is just floating in water. So whenever something floats on water, there are pathogens which can be there inside that which are resistant to chlorination. So for chlorination to be effective, first and foremost we must ensure that turbidity is not there in water. So we must have initial processes which are first taking care that water is not turbid. Then only can we achieve sufficient microbiological disinfection with chlorination, isn't it? Okay. So purification of water. So usually suppose a well is contaminated or a tank is contaminated and we must purify that water. You have been given the task as the public health specialist of that block or the medical officer of that PHC. You are seeing that there is some cholera outbreak or some typhoid outbreak that is happening and you want to disinfect the water source of that village or of that panchayat or of the service area of that primary health center, right? So what you need to do, you need to purify that water. So what are the steps of this purification? So first of all, if we are trying to purify by chlorination, we need a good estimate, a reliable estimate of what amount of chlorine is required. And how will I get that amount of chlorine from my routine disinfectants that I am having? So the first step in the process is to have an estimate of what is the amount of water in that well. So as you can see in the first step, all we are doing is we are just estimating the volume of water. So if it's a cylindrical well, then it will be pi r square h. So here we have used d. So d by 2 whole square becomes d square by 4. So that is why it's pi d square h by 4. That is the formula to measure the volume of the well if it's cylindrical. Suppose it is rectangular, then it will be length into breadth into height if it's cuboidal, isn't it? So it will depend on what type of well it is. Okay. Why are we multiplying by 1000? To come from meter cube to liters, right? Since usually everything will be given in meters, but water we usually measure in liters. That's why we'll come from meter cube to liter by multiplying by 1000. So now we get a reasonable estimate of the amount of water. Now once we have this amount of estimation of the amount of water, now I need to estimate what is my amount of chlorine that is required to disinfect this amount of water. For this we use this device known as the Horrock's apparatus. Okay, so the next step is to find the amount of, now what is the source of chlorine? Commonly our common source of chlorine is bleaching powder. Okay, we have some, now we do it with other things when we do industrial decontamination, disinfection in the sewage treatment plants or in the water treatment plants, we do it by other methods. But simply if you are doing in one well or one tank, then we do it by bleaching powder. So Horrock's apparatus tells us how much of bleaching powder is required. Especially if any of you are from that Sundarbans area, then you will know that every time after a cyclone or something occurs, when saline water comes into the ponds and then the fishes start dying, and once the fishes start dying, there is a exuberance of microbiological flora in those ponds. Then those ponds have to be disinfected and the disinfection is again done by bleaching powder, right? So Horrock's apparatus will tell us how much bleaching powder is required. Now once we know how much bleaching powder is required, what next? So we do not just pour bleaching powder directly into the water. Why? Because it increases the hardness of the water. The water becomes too hard to be used for domestic purposes. Okay. So what do? We first, whatever amount of bleaching powder is required, we take that amount of bleaching powder in a steel bucket, preferably a aluminium or a steel bucket. Okay. So we'll take that, we'll put that amount of bleaching powder down below. With that we'll add only a little bit of water to make that powder into a paste. Okay. Once the powder is into a paste, then we add more water up to 3/4 of the bucket. So up to 3/4 of the bucket we will fill. First we'll add the powder, then we'll make a paste by adding water little by little. Once we have a homogeneous paste without having any, clumps of powder, then we'll add rest amount of water to make up to 3/4. In a standard bucket, we should not add more than 100 grams of bleaching powder. Okay, if we require more than 100 grams of bleaching powder, we should do it in multiple times, right? So once we do that, once we have made that, now what to do? Now we'll allow it to settle. we'll allow it to settle for around 15 to 20 minutes. Once you allow it to settle for 15 to 20 minutes, what happens is the deposits, it sediments down, okay, and the supernatant is a clear solution containing hydrochloric acid and hypochlorous acid, okay. You have hydrochloric acid and hypochloric acid. Suppose you add, so you basically, what the active compounds are HCl and HOCl. HOCl ionizes as H plus and OCl minus, okay. So this and this are the best disinfectants with chlorination. Hypochlorite ion and hypochlorous acid are much stronger disinfectants than HCl. Among these two also, the hypochlorous acid is a stronger disinfectant than hypochlorite ions, okay, right. So the supernatant collects and the supernatant has this activated form of chlorine water. So what we do, we pour this supernatant into another bucket and we discard the sediment, okay. Only this supernatant solution is then lowered down in the, it is not poured from above, it is lowered down with the help of the rope such that it submerges in the water. Then we agitate the rope up and down and horizontally in order to ensure that the chlorine solution is properly mixed with the water, right. Once all of this is done, then we will allow 1 hour time, okay, at least 1 hour time for the chlorine to react with whatever microorganisms or organic compound that is there and to do its activity, right. Once it is done, after that we will take out some water and we will do a test to look for what amount of total chlorine is still there. The tests we use are usually a orthotolidine test or a orthotolidine arsenite test, right. So this is the process of disinfection of water, right. In this entire process, Horrock's apparatus is required for calculating how much chlorine do we need, okay, and that is what we will try and estimate in today's class, right. Any questions so far? Is this okay? This is not too much to understand, it's okay. So what is the requirement of the Horrock? First of all, what is chlorination? So as it is simply the process of adding the element chlorine to water as a method of water purification to make it fit for human purposes and consumption, isn't it? So chlorine is the most widely used disinfectant. It destroys the disease causing organisms mostly, right. Why do we chlorinate? A leading advantage, it is effective against bacteria and viruses. But remember, for chlorine to be effective against viruses, we need a lot of free chlorine, okay. That amount of free chlorine we usually do not keep, right. So it is very effective against bacteria, but its effectivity against viruses is little bit questionable, right. The chlorination process is also fairly easy to implement. As you just heard, this can be done by anyone. You do not need any expertise or a lot of hi-fi equipments to be able to do this particular thing, right. And lastly, it is an effective method in water emergency situations as it can eliminate the load of pathogens very quickly. So you can be there in a village in a very remote corner of this country where there is a sudden outbreak of a waterborne illness and the only source of water there is this particular well. There is no alternative source of water. So then people need water and they have no other alternative than to draw water from that well. So there this serves as a very, very good emergency technique where within one night, within 2-3-4 hours, you can get the water into a reusable state as long as it is not having turbidity. As long as it is not having turbidity. If the water becomes turbid, then chlorination is ineffective and unreliable, right? So what are the principles of chlorination? As I said, first thing is it has to be free from turbidity, okay. Next we need to know of some things like chlorine demand and breakpoint chlorination. We will come to them, okay. We have already discussed that contact period has to be for 1 hour and we need to have an estimate of the amount of free chlorine after the contact period of 1 hour. The minimum concentration of free chlorine is 0.5 milligram per dl. So at the end of my chlorination, after the contact period is done, there should be 0.5 mg per deciliter of free chlorine. Okay. And dose needed for chlorination therefore is the chlorine demand, that is the chlorine that is consumed, and the amount required to keep 0.5 milligram per dl of free chlorine. Now what happens to chlorine after it is added to water, right? So what happens, so there will be some organic acids. The chlorine, these are HOCl will react with them and they will form some derived byproducts, okay. There will be some organic nitrogenous compounds, very common, almost all organic compounds are having nitrogen in them. So whatever nitrogenous compounds are there, the acid will again reduce with the NH3 component and they will form something known as nitrosamines, okay. Nitrosamines will be formed, or chloramines will be formed, right. And if there are elements like iron or manganese, then they will react, FeCl3, MgCl2, these will form, they will precipitate. If they do not form at precipitating, then they will remain in the solution only and will increase the hardness, right. And then you have some free chlorine that will be remaining, that is HOCl and hypochlorite ions, okay. So when we give chlorine, part of the chlorine will be consumed here, part of the chlorine will be consumed here, and part of the chlorine will be consumed here. Once this is done, there will be some free chlorine that is remaining, okay. These are very, very minimal amounts. This and this are usually very, very minimal amounts, right. So action of chlorine, we already discussed that when chlorine is added to water, there is formation of HCl and HOCl. Among HCl and HOCl is much more powerful, okay. And in HOCl also, we want HOCl to be in this form. We do not want it to be ionized into H plus and OCl minus. For that, for chlorination to be effective, the pH range of the water must be between 6 to 7.5, ideally 7. If the pH becomes above 8, then what happens is HOCl becomes dissociated completely into H plus and OCl minus ion. OCl minus ion is much more less powerful than HOCl, okay. So we want water to be in the pH of 6 to 7.5 for us to be able to do chlorination effectively, right. So we already discussed that it kills the bacterial organism by doing damage to the cell wall. Viruses, it is relatively effective but not absolute. Against some protozoa and parasites, it is not effective, okay. Now what is chlorine demand? So chlorine demand has got nothing to do with the chlorine, it has got something to do with the water. So it is the amount of chlorine that will be required to gain some free chlorine in that water. So all of the chlorine that will be consumed by the organic substances in that water by reacting with chlorine, that is the chlorine demand of the water. So once the chlorine demand of the water is met, the free chlorine should be 0. So if I am giving some chlorine and at the end I have some total chlorine left, so if I can differentiate between these, we get the chlorine demand, isn't it? So to define it, when chlorine is added to a water source, it purifies the water by damaging the cell structure. The amount of chlorine needed to do this, that is the amount of chlorine that will be consumed, is known as the chlorine demand. So if the value is 0, water is already free of pathogenic microorganisms. Now what is total chlorine? Let me first go to this. So let us think of, so I added some chlorine to the water. Once I add some chlorine, part of it gets utilized to neutralize the chlorine demand of the water. Whatever is remaining is known as the total chlorine. Now of this total chlorine, little bit will be combined chlorines. That is, they will be in the form of chloramines. Chlorine that is combined with other compounds and there as chloramines. Chloramines also have a disinfecting property but not as strong as that of chlorine itself. Okay. So, whenever I add chlorine, first I have to neutralize the chlorine demand, then I will have some total chlorine. In the remaining total chlorine, part of that total chlorine will be chloramines, which is compounded with other organic compounds, and the rest will be free chlorine, right? The rest will be free chlorine. So, coming back, then total chlorine, the remaining chlorine concentration after chlorine demand is accounted for is total chlorine. So, total chlorine can be further divided into, as I said, combined chlorine and free chlorine, right? Now, how does this happen? So, initially we are giving chlorine. So, see, the x-axis is having the dose of chlorine that we are administering into the water, right? And the y-axis is having the chlorine residuals, that is what amount of chlorine is remaining after adding the chlorine. So, see, as we add the chlorine, what happens initially, the chlorine will be completely utilized in satisfying the chlorine demand of the water. Now, gradually we will start getting some chlorine residuals. Now, these chlorine residuals is due to the formation of chloramines, okay. But we cannot afford to have a lot of chloramines in the water, because as long as, so see, when we are having these chloramines, this chlorine whatever is increasing from here to here, there is no free chlorine in that. All of that is actually combined chlorine. Now, combined chlorine is not very effective, especially against viruses. So, we need some free chlorine to be there. So, we have to reach that point from where free chlorine starts coming. So, initially the chlorine residual will increase till point B. Then, as we start giving more and more chlorine above the chlorine demand, what happens is the free chlorine starts to fall. This is when part of the chloramines are getting destroyed. And as chloramines get destroyed, we gradually reach this point C, which is known as the breakpoint chlorination. From C onwards, what happens is whatever chlorine we add starts coming as, proportionately it starts coming as free chlorine. Then we are able to establish that, okay, whatever chlorine demand of this water was, that has been satisfied, that has been fulfilled. We will still have some chloramines, some combined residual chlorine we will still have, but we will also have some free residual chlorine. So, what is breakpoint chlorination? Breakpoint chlorination is that point, conceptually remember, it is that point on crossing which we start to get free chlorine in the disinfected water. We start to get free chlorine, right? So, after we start getting this free chlorine, we must maintain 0.5 milligram per deciliter of free chlorine at least when the water is said as safe to be used for domestic and drinking purposes, right? So, we must reach breakpoint chlorination before and have some additional residual free chlorine before we can say that this water is safe to drink or use for domestic purposes, right? So, what is combined chlorine? Combined chlorine has combined with wastes containing nitrogen or ammonia. So, chloramines. Combined chlorine will have this chlorinous order. If you see, when we go to the swimming pools, they have combined chlorine, okay, and that at times causes us some irritation in our eyes. চোখ গুলো লাল হয়ে যায়, irritation হয়, ঠিক আছে? What is the source of nitrogenous waste in swimming pools? Okay, so it has little disinfecting power, but the breakpoint chlorination is used to get rid of combined chlorine. So, this excess combined chlorine which causes problems to us, that we need to get rid of by reaching the breakpoint chlorination. Once we reach the breakpoint chlorination, that excess amount of combined chlorine which causes irritation will go away. The remaining amount does not cause any problems, right? So, combined chlorine, what is the amount of combined chlorine? So, by doing those tests, we can estimate what is the amount of free chlorine, and we also have methods to estimate the amount of total chlorine. From this picture, we have methods to estimate the total chlorine we have methods to estimate the free chlorine. So if we subtract these two, then we get the third one, which is combined chlorine, right? So the combined chlorine can be calculated as total chlorine minus free chlorine, right? Now what is breakpoint chlorination? Breakpoint chlorination is defined as the point when enough chlorine has been added to a quantity of water to satisfy its disinfecting demand or chlorine demand per se, right? So the chlorine demand of the water has been satisfied, and from then on free chlorine starts to be present in the water. So that is the breakpoint chlorination. At breakpoint chlorination, all chlorine added to the solution is consumed by chemical reactions and resulting in no free available chlorine in the water. After breakpoint chlorination, as we start adding chlorine, it comes arriving as free chlorine in the water, right? So this can be given as a short note, breakpoint chlorination, okay? If you are given it, then first write what is the context, then write what is breakpoint chlorination, then write what is its importance, and try to give this thing, okay? That makes the answer complete. Okay. Now what is superchlorination? Now sometimes waters are very polluted, okay? Waters are very polluted. So in those extremely polluted waters, this doing estimation, adding some chlorine, again doing estimation, adding some more chlorine, this is a very tedious process. So there what we can do is, we can add huge amounts of chlorine, okay, at the end of which there will definitely be some chlorine, free chlorine present. That is known as superchlorination. But superchlorination we do not do. Why don't we do? We don't do it because we do not want to waste our resources. We are unnecessarily wasting a lot of what? Disinfecting agent without going by the scientific method of calculation. Okay, so we prefer to do breakpoint chlorination and adding some free residual chlorine, because in superchlorination we again have to remove the excess chlorine, because too much of free chlorine is also problematic. It will have lot of free radicals, right? So we cannot keep a lot of free chlorine also in the water. It is not acceptable taste wise also. It is not acceptable taste wise. So we have to remove that by adding sodium thiosulfate, okay? But superchlorination is not routinely practiced, right? Now orthotolidine test. I was telling you that at the end we do orthotolidine test and orthotolidine arsenite test. What orthotolidine does is, it sees both the free and combined chlorine. That is, it gives you an estimate of the total chlorine, okay? The orthotolidine arsenite test, it has the advantage of finding free chlorine and combined chlorine separately, right? Like free and total we find, combined we can estimate, right? Now coming to our Horrock's apparatus, okay? This Horrock's apparatus, it is used for estimating the amount of bleaching powder that is needed to disinfect 455 liters of water. Why 455? That is what is equal to 1 gallon, okay? In that other system, not the metric system, we used to use gallons of water, isn't it? This much gallon. So 1 gallon is 455 liters. So that is why Horrock's apparatus tells you how much bleaching powder is required to disinfect 1 gallon of water, okay? So what are present in Horrock's apparatus? What you can see is, you have 6 transparent glass cups and you have 1 black colored glass cup. So if I just open this here, you will be able to see that there are 6 glass cups like this, okay? There are 6 glass cups like this, they are there, 6 of them, okay, like this. And then you have a black cup, okay, and see it is turned black up to 75%, isn't it? So this is the black cup. And then you have some reagents. This is bleaching powder. This is starch soluble. This is indicator. and this is potassium iodide. So we use starch iodide, okay, by mixing. And these are the stirrers. So you have many stirrers. You see, we have 7 stirrers. Why? Because we must use a separate stirrer for each of these cups. So each cup will have its individual 1 stirrer, right? Right. So at the end of the class, you can come in front and you can see it for yourself, okay? But now how to do it? So what are the contents? As we have already shown, it has got 6 white cups, each of 200 ml quantity. It has 1 black cup with a circular mark on the inside. We saw that black mark. It has 2 metal spoons, each to hold 2 grams of bleaching powder in them, okay? It has 7 stirring rods, 1 for the black cup, 6 for the 6 transparent cups. It has a special pipette, okay, 2 droppers, starch iodide indicator solution and an instruction folder. So this is all that is contained in a Horrock's apparatus. Now what are the steps of estimating the required dosage of bleaching powder? So first what we have to do is we will take 1 level spoonful, that is 2 grams of bleaching powder into that black cup, okay, into that black cup, and it is made into, just like we were talking of bleaching powder there. We will add little bit of water and we will make it into a thin paste. Once the paste is made, we will add some additional water up to the black circular mark to make the chlorine stock solution, okay. So now we have the stock solution of chlorine. Here there is not a lot of chlorine, so no need to discard and do all of that, okay. Now the 6 white cups will be filled up to their water mark. Mark is given. So in each of these 6 cups, 200 ml of water we will fill, okay. Then what to do? Using the pipette provided with the apparatus, we will add drops of the stock solution into each of these cups. So if the first cup, we will add 1 drop, second cup we will add 2 drops, third cup 3 drops, like this. 6th cup we will add 6 drops. So 1, 2, 3, 4, 5, 6 drops we will add. Then what we will do? We will wait. We will stir the water in the cups with individual stirrers, 6 individual stirrers, and then we will wait, right. We will wait for the chlorine to act. Once the chlorine is done acting, we will add 3 drops of starch iodide indicator to each of the white cups, okay. Development of blue color indicates that there is free chlorine. So wherever there is blue color, we get to know that. So if it is in the second cup, then we know that 2 drops is enough. If it is in the 4th cup, then we know that 4 drops are enough. Depending on the which cup develops first, we get an estimate of the amount of bleaching powder that is required to disinfect 1 gallon of water. So if it is 1 spoonful, if the second cup, then 2 spoonful, if the third cup, then 3 spoonful. So imagine just little bit, for 455 liters, just 1 spoonful, 2 grams, okay. So not a lot of bleaching powder is usually required, isn't it? So if 6th cup, then 6 spoonfuls, that means 12 grams in all to disinfect 455 liters or 1 gallon of water. What if even the 6th cup does not develop blue color? Then we do not go for this bleaching powder estimate of disinfecting the water. Then we conclude that chlorine demand of water is very high and it is better to use some other method of clearing the water before disinfecting. Okay, that water, if it is having a chlorine demand that is requiring more than 12 grams of bleaching powder for disinfection, it might have turbidity, it might have other problems with it. So it first needs to be treated by other methods to clear itself out, and then we will go for the bleaching powder estimation. Okay, don't say that we will get another Horrock's apparatus with 12 cups. Okay, no. So if there is more than 6 cup also does not develop the blue color with starch iodide, then we say that no, chlorination cannot be done at this stage, we need some other method of disinfection, then chlorination, right. So there is this one video that is there, I will not play it right now, you listen to the video, they will show you how that step is done, I will give you the PPT, you see it from there, okay. So now that we are done, let us just do some problems, okay. These are problems which can come in your exam, okay. So open your copies everyone. So what will you follow while solving this? You will follow this one. The initial steps that we discussed, this one. You will calculate the amount of water and then you will find out the volume of bleaching powder to be added to that amount of water, isn't it? Determine the quantity of bleaching powder with 25% available chlorine required to chlorinate a well measuring 4 meters in length, 3 meters in breadth with 6 meters of water in it. So though it is like a well, it is almost like a tank, isn't it? It is rectangular, it is not circular. So 4 meters in length, 3 meters in breadth and 6 meters in depth. Horrock's test done on the sample of water shows blue color in third cup. So find out the amount of bleaching powder that will be required to disinfect this well. Okay, find out the amount of bleaching powder that will be required to disinfect this well. Of the water. So how will you find out the water? What is the formula? Length into breadth into height, isn't it? So it will come as 72 what? Meter cube. You need to convert that to liters. 72,000. So the volume of water is 72,000 liters. Now it becomes very simple by unitary method. Third cup shows blue color, means 6 grams of bleaching powder are required to disinfect 455 liters of water. 6 grams of bleaching powder is required to disinfect 455 liters of water. That means 1 gram of bleaching powder is required to disinfect 455 by 6 liters of water. Sorry, 455 liters are disinfected by 6 grams of bleaching powder. That means 1 liter of water is disinfected by 6 by 455 grams of bleaching powder. That means 72,000 liters of water are disinfected by 6 by 455 into 72,000 grams of bleaching powder. What is the answer coming as? 949. So what is coming as is 949.45. Clear? That 25% has got nothing to do with your sum, that is just a confusion. The bleaching powder is such that it is having 25% free chlorine. It's a property of the powder, nothing of your concern. So next question, we'll go to the next question. Go to the next question. So it's a similar problem only, just now the well is a cylindrical one. Okay, so it will be pi r square h, or as diameter is given, so pi d square h by 4. Pi d square h by 4 into 1000. So be very careful, diameter, radius, during your exams, when you give your final exams, do not confuse. Okay, maybe diameter you forget to make it into radius. Okay, the entire thing becomes wrong. Even if you know the thing, we cannot give you marks. So be very, very careful. Read the question once or twice. So again, this is third cup. What is coming? So 6 grams. So then calculating, what is the answer? So in the previous sum we had around 950 grams. That means we would need to prepare the bleaching powder in a few number of occasions, isn't it? One time we would be doing around 100 grams. So we'll do it for 100 grams, we'll pour the supernatant, we'll discard, then we'll again pour the supernatant, we'll discard. Like this we'll have to do for a few number of. So now what we will do is, you will come in benches of 3, you will come and I will show you the apparatus. So the first 3 benches on this side, first bench on this side and first 2 benches on that side, come in front. Therefore, these are the 6 glasses. 1, 2, 3, 4, 5, 6. They have a marking up to 200. তাহলে এখানে 200 অবধি জল ভরবো 6টায়, 1 2 3 4 5 6 করে রেখে দেবো। ঠিক আছে, রেখে দেওয়ার পরে তারপর আমরা এইটাতেও দেখো 200 অবধি আছে, তাহলে আমার যতটা দরকার আমি এক চামচ, এই যে মেটাল স্পুন আছে, ঠিক আছে, এই মেটাল স্পুনে এটাতে একবার নিলে 2 গ্রামস থাকবে। ঠিক আছে, চাচাচাচির ব্যাপার নেই, তুললে যেটা থাকবে দ্যাট ইজ 2 গ্রামস। ওই 2 গ্রামস নিয়ে আমি এটার ভিতর দিয়ে তারপর এই উল্টো দিকটা দিয়ে পেস্ট বানাবো চিপে চিপে। ঠিক আছে, জল দিয়ে অল্প পেস্ট বানিয়ে নিয়ে দেন আই উইল অ্যাড ওয়াটার আপ টু দিস মার্ক এন্ড আই উইল স্টার উইথ দিস। ঠিক আছে, আচ্ছা আমি হরক্স অ্যাপারেটাস দিয়ে আদৌ ক্লোরিন ডিমান্ড এস্টিমেট করতে পারবো কিনা তার আগে আমাকে কি দেখতে হবে? টার্বিডিটি দেখতে হবে। তাহলে আমাকে দেখতে হবে ইফ দ্য ওয়াটার ইজ ক্লিয়ার। আর কি দেখতে হবে? পিএইচ, তাই না? আই উইল অনলি ডু ইট ইফ দ্য পিএইচ ইজ বিটুইন 6 to 7.5। তো দেখো এখানে একটা পিএইচ ইন্ডিকেটরও দিয়ে রেখেছি। দিস ইজ দ্য পিএইচ ইন্ডিকেটর সলিউশন। ঠিক আছে, তো এই সলিউশনটা আমরা একটুখানি নিয়ে পিপেটে করে উই উইল ড্রপ ইট ইন কোনো একটা মাস্টার স্যাম্পল অফ ওয়াটারে একটু ড্রপ করে উইল সি and based on the color we can find what is the pH. So যে pH আসবে, if the pH is in the range of do not make it a fish market, তাহলে if it is in the range of 6 to 7.5 then we can go ahead with the next step and do it. ঠিক আছে, আর এখানে আমার রয়েছে ব্লিচিং পাউডার, তাহলে এখান থেকে নিয়ে আমি এটার ভিতর দিলাম, দিয়ে তৈরি করে এই সব কটাতে এই পিপেটটা নিয়ে আবার 1 ড্রপ করে 1 ড্রপ 2 ড্রপ 3 ড্রপ 4 ড্রপ 5 ড্রপ 6 ড্রপ একটা করে স্টার করব। স্টার করার পরে একদম শেষে এখানে দেখো এক তো রয়েছে, এখানে স্টার্চ আয়োডাইড পেপার রয়েছে। ঠিক আছে, রেডিমেড স্টার্চ আয়োডাইড পেপার থাকতে পারে, তাহলে তো খুব সহজ। স্টার্চ আয়োডাইড পেপারগুলো ডিপ করে দেবো, যেটায় ব্লু কালার আসবে সেটা ফার্স্ট ওয়ান। ঠিক আছে, তো সবকটা ইউজ করবো না, 1 ড্রপ দিয়ে শুরু করব, পেয়ে গেলে আর বাকিগুলো টেস্ট করতেই হবে না, তাই না? আর যদি না হয় তাহলে তার জন্য এখানে পিউরিফাইড পটাশিয়াম আয়োডাইড আর স্টার্চ রয়েছে, ওটাকে মিক্স করে স্টার্চ আয়োডাইড আমি সলিউশন বানিয়ে নিতে পারি। ঠিক আছে, দিস ইজ অল। ঠিক আছে, তো এটা কি তোমাকে স্পটারে দিতে পারি। ঠিক আছে, স্পটারে কোনো একটা ধরো এইটা রেখে দিলাম, ঠিক আছে, বা এইটা রেখে দিলাম। ঠিক আছে, দিয়ে জিজ্ঞেস করলাম হোয়াট ইজ ইটস রোল ইন হরক্স অ্যাপারেটাস। ঠিক আছে, তাহলে বলতে হবে বিফোর ডুইং দ্য chlorine estimation with Horrock's apparatus we need to find out the pH of the water. This indicator is used for measuring the pH of water before going for chlorine estimation. Done? চলো। না, হসপিটালে আসবে 100% হসপিটালে দেবে। ঠিক আছে, এটা হয় তোমার ভাইভার টেবিলে থাকতে পারে অ্যাজ আ ইনস্ট্রুমেন্ট, আর না হলে তোমার স্পটারে দিতে পারে। ঠিক আছে, না হলে শর্ট নোট যদি আসে শর্ট নোট আসবে। হ্যাঁ, আর এই অঙ্কটা তোমার প্রবলেমস হিসেবে না, থিওরিতে আসবে না কখনো। দুটো প্রবলেম থাকে তোমাদের, এপিডেমিওলজিক্যাল আর স্ট্যাটিস্টিক্যাল, তার মধ্যে একটা প্রবলেম এটা দিলেও দিতে পারে। ঠিক আছে, দিলে এই দুটো অঙ্কর মধ্যেই জাস্ট নাম্বারগুলো চেঞ্জ করে দিতে পারে। ঠিক আছে, আচ্ছা, সো দিস ইজ ইয়োর হরক্স অ্যাপারেটাস। তাই তো, কি কি রয়েছে দেখ, এখানে 6টা গ্লাস রয়েছে, সবাই দেখতে পাচ্ছিস 6টা গ্লাস। 6টা গ্লাস আছে এরকম ট্রান্সপারেন্ট গ্লাস, যেগুলোতে ক্লিয়ারলি এখানে মার্ক করা রয়েছে। তো আমরা 200 ml পর্যন্ত ভর্তি করি এগুলোতে জল, তাই তো? Bengali everyone and so we'll fill these with water up to 200 ml, right? Then this is your colored glass to prepare the bleach solution, isn't it? Okay. So what we do initially before doing the chlorine demand estimation, we need to know 2 things. What are the? First thing, we need to see that the water is free from turbidity, and secondly we need to see that the pH is between 6 and 7.5. So turbidity we can see just by looking at the water sample whether it is turbid or not. If it is free from turbidity, next we need to know the pH. So we have this pH indicator solution. So we can take in the stock solution, we can take some water from there and test the pH with the pH indicator solution. If it is within 6 to 7.5, the water will be in between these two colors, this color and this color. Okay, and we'll be happy that okay, the pH is within range, so we can go for water quality testing, isn't it? Now, so what to do? Once we know that the pH is within range, what we will do? We will first take 2 grams of bleaching powder with this spoon, right? So we'll dip this spoonful in this bleaching powder solution. It is kept in a black one. Okay, so we'll take it, otherwise it will be oxidized with light. So we'll take it 1 spoonful, no কাটাকাটি এরকম কিছু করব না, ঠিক আছে? যা তুলবো উবুর উবুর করে, that is 2 grams তুলে we'll put it here, we'll add little bit water, we'll paste it with this. Okay, then we'll add some water up to this level and stir it with a stirrer. যে স্টারারটা এটার জন্য ইউজ করব সেটা এখানেই থাকবে, because stirrer itself in its body can have 1 to 2 gram drops of the liquid, so we will not change stirrers. হ্যাঁ, দিয়ে তারপর এখানে স্টক সলিউশন যখন তৈরি হয়ে গেল, we'll take a pipette, we'll take stock solution from here, first glass এ 1 drop, second glass এ 2 drop, third glass এ 3 drop, এরকম ভাবে দেব. Then we'll use individual stirrers for each of these glasses, stir it well, let it rest for 30 minutes. 30 minutes, ঠিক আছে? Once it is done, after that we'll need an indicator. So এরকম starch iodide পেপার থাকে, ঠিক আছে? এই পেপারটা 1 টায় দেব, কালার হয়ে গেল ব্লু, তো হয়ে গেল 2 টায় দেব, যদি এখানে হলো না তাহলে 2 টায় দেব, হলো না 3 টায় দেব, এরকম ভাবে, ঠিক আছে? আলাদা আলাদা পেপার বা এটাকে ছোট ছোট করে কেটে, যদি এই পেপারগুলো না থাকে তার জন্য এখানে starch, soluble starch আর potassium iodide দেওয়া থাকে, এটা দিয়ে we can prepare freshly prepared potassium iodide solution, ঠিক আছে? সেটা দিয়েও করা যেতে পারে. ওকে, এনি কোয়েশ্চেন্স? ঠিক আছে, সো এটা কিভাবে থাকতে পারে? দিস ক্যান বি এ ইনস্ট্রুমেন্ট ইন ইয়োর স্পটাসে আমরা এই গোটা জিনিসটা বা এর কোনো একটা জিনিসকে দিয়ে দিতে পারি, জিজ্ঞেস করতে পারি এটা কি ব্যবহার কি ইত্যাদি ইত্যাদি, হোয়াট এভার উই হ্যাভ টট ইউ ইন দিস ক্লাস. আর কি আসতে পারে এটা থেকে? দিস ক্যান বি দেয়ার ইন ইয়োর ভাইভা টেবল অ্যাজ এ ইনস্ট্রুমেন্ট, or this problem can come as one of the 4 problems that will come in your final exam practicals, or you might get a short note, Horrock's apparatus, breakpoint chlorination, chlorine demand, এগুলোর উপর short note আসবে, ঠিক আছে?